My name is Dr. Gerald Kangelaris. I'm a board-certified otolaryngology head and neck surgeon. I started my career originally with an anticipation of going to business school. Studied economics as an undergrad. But in my first career as a consultant, I quickly learned that I wasn't feeling I had a meaningful impact in people's lives of the world, and I transitioned to a career in medicine to have a more tangible effect on people's lives, and just feeling that I had a good accomplishment in the work I was doing. I ended up selecting a career in otolaryngology, ENT, because I really fell in love with the idea of the head and neck. We have a variety of specialty senses with hearing as well as smell, swallowing. It's part of the body that connects intimately with other people, and it's the sort of outward face, literally, of our connection with the rest of the human world. The anatomy in the head and neck is beautiful and complex. There are all sorts of nerves and specialty functions that we have up here that we don't share with other parts of the body. And I just found it incredibly fascinating and intriguing. I grew up in a town called Troy, Michigan, which is a suburb of Detroit. And when I was growing up, my dad, who was an immigrant from Greece, opened a restaurant when I was a young child. And my whole life, he really pushed the idea that business was the career to go into. And that was a track I was heading on. In my first job, I was working with a consulting firm in Washington, D.C., and we were doing environmental consulting for the federal government. And it was a mission and a topic I felt incredibly strongly about. But I had this moment where we had done this project that took several months, lots of hours, lots of late nights, lots of discussions and meetings. And at the conclusion of it, we produced a document. And while I was incredibly proud of that document and felt we had done really good work, it had this feeling of emptiness, or for me, it felt a little unsatisfying. Around that time, I had several friends who were in medical school, and they were telling me about all the patient encounters they had and these surgeries they were doing and procedures and things that felt incredibly tangible and directly improving patients' lives. And it was at that moment that I thought a career in medicine might be right for me. My family opened the restaurant when I was 7 years old, and it was a true family affair. Both my older sisters and I worked in the restaurant from a young age. I remember being 9 years old and peeling potatoes and opening all sorts of bags of coffee. And at one point, when I was probably around 14 years old, I was working the cash register. And back then, the cash register, there was no credit card, so we just took cash. And I just remember at one point working at the lunch hour and having 30 people deep, and just having to take money and do the calculations and give people their cash back. And at one point I kind of screwed up and gave somebody the wrong cash, and that person sort of got upset with having a 14-year-old person handling money. And I just remember how important it was for people to feel taken care of and felt like the person they were interacting with was a high quality person doing good work that they could trust. And that was a message that I've taken with me my entire life. I learned from a very early age working at the restaurant that customer service is incredibly important, and that no matter how small or trivial, people want to feel taken care of. And I think that sort of customer first mentality is translated into my career with a patient first mentality. You have to treat every patient with the respect, time, and attention that they need and deserve to feel their best, because every patient's an individual, and in that moment, no person's more important than another person. In otolaryngology, we have a really interesting field in that we are the surgeons as well as the medical providers. Many surgical fields will have a medical correlate. So cardiac surgery has cardiologists, and urology has nephrologists. In otolaryngology, we combine elements of both surgical care along with medical care as well as specialty care. It brings us as physicians to really try to take care of the entirety of the patient, not just do their surgery and move on to the next patient. We are going to take care of that patient from beginning to end with their workup, with their treatment, with their post-care management, with continuing medical management. One of the things that I found really intriguing about otolaryngology was the fact that we see patients who are very young, as babies and children, into their middle ages, into their older years. We do both the surgical management as well as the medical management. We take care of patients who have problems ranging from I can't breathe well out of my nose, all the way up to I have a really invasive, aggressive cancer. We have healthy patients, sick patients, young patients, old patients. I really enjoyed the breadth and depth and diversity of our patients. It's really fascinating and really enjoyable work. So when I decided to change careers and go into medicine, I went back to the University of Michigan to do a post-baccalaureate program and take all the required prerequisites that I hadn't done as an undergrad. And then I applied to medical school. So over the last 20 years, we've seen a shift in the paradigm of medical care from a transition of many physicians working in independent practices to becoming employed physicians with larger health systems or in the academic healthcare setting. The hope for this is originally was that people could provide better care at lower cost, but ironically, as we've seen progressive more consolidation in the medical marketplace, whether it be on the context of providers or insurance companies, we've seen fewer players in the market who have a bigger amount of power, and that has led actually to a progressive rise in healthcare costs. As a smaller independent company, we are able to provide that same care for lower cost to patients and usually get studies and surgeries and diagnostic tests in a shorter amount of time. Being in a group that is an independent group has allowed us to provide, I think, high quality care at lower cost for patients with just less muss and fuss for the patient and their experience as they work through their healthcare journey. My approach to patient care, I think, taking lessons from my childhood and my family's small business, is to understand that I think every patient deserves to be treated with the time, the attention, the respect and care that patient needs. I try to treat every patient that is in front of me in the clinic as the most important patient at that moment. I want patients to feel seen, heard, and understood. And while I may not be able to solve every problem for them, I want them to feel that I am going to do whatever I can do to help them achieve their healthcare goals. As a surgeon, I'm a very type A person, and I want every surgery to go perfectly well. Even though we can never achieve perfection, we always have to strive for perfection. And I think that's the mentality I take into every surgery that I do. As I mentioned, I have a strong desire to make sure that every patient feels cared for and taken care of. And I think that involves giving your 100% day in and day out. I really enjoy working with people, and I really find a lot of satisfaction and meaning in the work that I do. And even though as physicians we tend to work long hours and can work late at night and early in the morning, and having to add patients on to our clinic schedule that's already full and busy, that sort of satisfaction knowing that you're having a difference in someone's lives is incredibly motivating and keeps me going.